Hi, I'm Dr. John Martinez, and I'm part of the Coastal Dermatology and Plastic Surgery group. My background has been primarily academic. This is my second career in dermatology where I'm practicing actually in a clinical group. My education comes from Stanford University. I am a fellowship trained Mohs surgeon as well as a residency trained and accredited dermatologist. I also have clinical expertise in melanoma because I did a melanoma immunology fellowship at UC San Francisco. It was there that I learned firsthand on how important it is to diagnose this early. For instance, in the United States, about 200,000 melanoma cases are diagnosed each year. Fortunately, about 100,000 of these are primarily very early melanomas, which have a very high cure rate. The best treatment is to diagnose early. This comes from being able to get screened once a year, and if you have a personal history of melanoma, maybe every 3 to 6 months thereafter. But most individuals feel that melanoma only occurs in raised moles or nevi. That is actually incorrect because some melanomas are flat and very, very small, yet are significant. Melanomas can be flat, they can be raised, and there is a rare melanoma subgroup called a melanotic melanoma, which has absolutely no color at all. The types of moles that we look at is the ABCDE pattern. We talk about moles being asymmetrical. So when you look at your moles, they should be perfectly symmetrical, whether they're round or oval. You should be able to bisect it into two pieces and have two equal pieces. We also talk about borders. A mole has a distinct border. You can tell where the mole begins and where the normal skin starts. Moles that are irregularly shaped or have a scallop border usually are of more clinical significance. We also talk about colors. The color of a mole should be distinct and even. You should have a nice tan mole, fairly nice brown mole, or a mole that has one even color. Now, moles that have multiple colors, particularly moles that have dark brown or black, those are not good colors for any nevi, especially a slate blue or a gray color. D stands for diameter. We like moles to be practically smaller than 6 millimeters, or roughly about the size of a pencil eraser. And that's a good cursory measurement that you can use at home. Take an unused pencil eraser. If you can cover most of your moles with that, that would be a good screening. The last is E, which is elevated or erythema or red. Also not a good color for any nevi. The best thing to do is to wear sunscreen, wear protective clothing, especially nowadays we have UV rated clothing. Some of it is as high as 65 SPF. Schedule an appointment with a dermatologist. All of our clinicians here in our group are fantastic individuals. They're excellent at diagnostic criteria for melanoma, and they also have a very proficient clinical history of being able to diagnose these moles.